Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in this Thursday morning. You know, you hear this all the time, that when somebody gets cancer, it affects the whole family. It is absolutely true. And it probably is true for almost all diseases and conditions and anything. Somebody's in an accident, it affects the whole family. And we're going to speak today to Dr. Kristy Paquette, who has been with us before, and she's sitting here right now. She's a doctor of physical therapy for Strive Rehabilitation. Renee Genther has also been with us before. She is an oncology patient navigator for Ocala Health. And of course, Brittney Marthaller is here with her beautiful new haircut. Well, she's always beautiful, always beautiful. Communications manager at Ocala Health. And one of the things we are talking about is the new survivorship clinic for cancer patients at Ocala Health. So that on the surface sounds like there's a sad element to it. So, but anyway, good morning, ladies. How are all of you?
Good morning.
Good morning.
There, I know, I hear you. Okay. Is this, so it says new on my list. Is this really new?
It is.
And that means somebody saw a need for it, right?
Absolutely. Survivorship's been a growing field for quite a while now, and most recently it's become mandated. So in 2015, absolutely, it's going to become part of a cancer patient's care. And so as we move forward, if you're an accredited cancer program, you're going to need to have a survivorship component to it. And nurses have seen a need for this for years and have
for
really
themselves?
For the patients.
Okay.
And they've really been the forerunners on this. And so survivorship's actually been evolving for probably over a decade now, but it's really starting to take hold and be recognized as a very important part of patients' care.
And I hope I'm not stepping into the wrong territory, but is this the people who live after the patient dies?
This is for the patient.
The patient?
The patient. The patients are survivors, absolutely.
Oh, okay.
Yeah,
so this is not a sad story.
No, not at all.
This is a happy story.
This is awesome.
Oh, I thought this was for the people who, well, he's gone. Let's go sit around and talk about it.
No. This isn't bereavement service. This is survivorship.
Okay.
When someone's diagnosed with cancer, they're considered a survivor from the moment
My
they're
mom was a
diagnosed.
survivor for 20-something years, right?
Yes. So this is for the patients. And what's happening is we have over 14 million cancer survivors in the United States now. And what's happening is when they're finished with their treatments,
Right.
or if they're living with cancer, because so many patients now live with cancer, more like a chronic disease,
Right.
they need support, and it's hard. There's a lot of discontinuity in our medical system now, where our oncologist is covering this part, the cardiologist is covering this part, the pulmonologist is doing this. Not everybody has a primary care doctor anymore, and the care gets really fragmented, and a lot of times the patients kind of get confused or lost in the shuffle.
Okay.
And when you're managing cancer, it's pretty hard to navigate that sometimes, and sometimes patients don't get the care or the services they need because they're not even aware they're supposed to be. So by doing survivorship, you put together a 5-year care plan for each patient.
5 years.
5 years.
Can you help me understand what it looks like if you don't get the survivorship care?
Absolutely.
What
I
does that
see
look
it every
like?
day. What happens is patients will sometimes, for lack of understanding, get treatment for cancer, and then for some reason, something's not communicated, and that patient might end up just going back out into the general population and not following up with their colonoscopies,
Right.
and screening exams.
Right.
And usually once you've had cancer, you go on a heightened screening process versus the normal for a while. And you're seen more often, every 3 months for the first 2 years usually, and then 6 months for the remainder of that 5 years. But sometimes patients just kind of meander off. And they don't do it intentionally, they just don't know.
Well, because that's how they live their whole lives.
Exactly. So they just like, okay, I'm done, I'm going back to normal.
Yeah,
and there really isn't a normal anymore, it's a new normal.
So how do we know, I mean, do we separate those who need it from those who don't? You say it's mandated. There must be some people who don't need it. Am I right or
Well,
wrong?
you can't make people do a survivorship plan, but most cancer survivors are very engaged in their care. The majority really are, but sometimes they really don't know what to do, and there's a lot of information on the internet. There's a lot of information that's given by friends and family with good intent, and there's just a lot of misunderstanding. So by bringing them in, getting all of their treatment information, their summaries, taking all that information, doing a physical exam, assessing where they're at that time, figuring out what they need, what kind of services they would still benefit from. Because even when you finish treatment, you still might have problems with your blood counts being low because you're recovering from chemotherapy.
Okay.
You could have neuropathy and problems with physical activity because of the treatments.
Scarring.
You could have body scarring problems.
Weakness.
Exactly. Fatigue and weakness are still things that are going on even when you finish treatment. I always tell patients, as long as you're on treatment, it's probably going to take you at least that long to recover from the treatments. And so a lot of times patients feel like maybe there's something wrong with them because they're not back to normal right away.
And is it psychological in any way?
Absolutely.
Oh, it is. Okay.
Absolutely, it can be. Not always, but it can be. And if you go through something as traumatic as that, it would be kind of normal to have some psychological
So I always hope I'm not saying something wrong, but women are so different from men in the hair thing. I'll just jump right to it. So, right? So, I mean, you lose your hair. A guy says, "Oh, cool, I look like Telly Savalas or something." Women don't want to look
Nobody
like
knows
Telly
who Telly Savalas is. You might have to update that.
Yeah, change that.
Really?
person.
No way.
Van Damme.
Bruce Willis.
Oh, okay, Van Damme.
Oh, Bruce Willis.
You really don't know who Telly Savalas is?
I do.
Oh, you're kidding.
But I'm older than you.
Yeah. I don't have any lollipops.
You had no idea.
Brittney didn't know who that is. Yeah.
I couldn't think of a bald-headed guy.
Just trying to help
Daddy
you.
Warbucks.
No, that's also not good.
That's also old.
No, who's that guy on the show? Howie Mandel.
Howie Mandel.
Howard,
Yeah, but I
Everybody
remember
knows
him with hair.
You too.
Right. The stand-up days.
So, but anyway, going to my point, I mean, is that something that's not superficial? That's important. Hair is important to a girl, right?
Yes.
We do a song called
Yes,
"Hair
it
is
is.
Important to a Girl." So, I mean, is that part of it?
Well, the superficial external things are also important, but when you get a cancer diagnosis, especially women, mothers, we have people, part of our role, our definition is, my kids need me, my husband needs me, my job needs me. And so dealing with that shock and the grief, how am I going to do all this stuff?
Right.
It's just important and critical to have.
Do you put people in physical therapy even though they don't need physical therapy, but they do complain of fatigue and maybe emotionally that would help them get out of that slump by just going through some of the motions of physical therapy?
Well, fatigue is definitely a diagnosis. I mean, it's a legitimate diagnosis, so to speak. I mean, physical therapy is different than like strength training or a personal trainer. Our goal as a therapist is to get you back to your base level. I mean, your normal function, your normal level. But fatigue is definitely a legitimate diagnosis. So absolutely. I've worked with breast cancer survivors who've had mastectomies, reconstruction. I mean, the scar tissue is unbelievable in some of these people.
In what way? In what way is it unbelievable? Is it hard? You mean
Well, everybody heals differently.
aesthetically unbelievable, or is it
Functionally,
painful?
I mean, I've had patients who couldn't lift their arm past their shoulders.
It gets tight.
because of the
Sometimes
scar
when they do
Oh,
surgery, they get
really?
really tight.
Oh,
and then
wow.
they need therapy to learn how to
so
move.
we've
So
had
you
to,
can work through that.
yeah, we've had to work on, getting that back and rebuilding that strength. Some people have their muscle tissue removed. So, rebuilding this so you can just function and reach that can on the top shelf.
Exactly.
Right?
That's
Or-
my
or
role.
brush
My
the-
job is to get the camera.
Because yeah.
When you were talking about fatigue, a lot of times when patients finish their chemotherapies, especially, they have low red blood counts, or anemia we call it. And when you get down to a hemoglobin of 10, just walking from point A to point B, it can be fatiguing. And this is a patient who's maybe been very active in their whole life, but when you don't have enough red blood cells to carry the oxygen,
So that was
your
some-
energy just goes down.
So that's something we didn't have, and that's now I understand why it was mandated, because we weren't addressing those issues.
Well, and they're hoping that as we have more cancer survivors, that by them taking a more active role in that plan of observation, heightened surveillance, that they'll actually do better as far as less recurrence. And patients, they've shown that patients who when they're done with treatment, obesity, all these different, sedentary lifestyle contributes to a higher rate of recurrence. So it's really important to get these patients involved in their health again and get them in charge of it again so that they can get back.
Renee, we need to take a little break. We'll be right back. We are learning about the new survivorship clinic for cancer patients out of Cala Health. We'll be back after this.
The weather is brought to you by myfwc.com. Safe boating is no accident. It'll be partly sunny today and milder this afternoon with a high of 64 to 70. Tonight, mainly clear, chilly, lows ranging from the lower 40s in a few inland spots to the upper 50s along the coast. Tomorrow, partly sunny with a high of 71 to 75. On Saturday, times of clouds and sunshine, breezy and warm, high 74 to 78. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Let's face it, nowadays it can be hard to find American-made products, and that's something that Cabinet Sales of North Florida is well aware of. That's why they're an authorized dealer of Wellborn Cabinetry, family-owned and American-made since 1961. Cabinet Sales of North Florida is your answer for complete turnkey kitchen remodels and whole-house cabinetry. Their cabinets are finished with solvent-based enamels for a long-lasting finish that's second to none. Available in an incredible selection of door styles and colors to choose from to turn your dream kitchen into a reality. In-house design and drawing services are available. Come by and see our displays for yourself at the Floors of the Villages, 3935 County Road 216 in Oxford, or Exquisite Design Kitchen and Bath in Bellevue, right across the street from the Bellevue Library. So whether you're looking for bookcases, kitchen, bath, or outdoor kitchen, Cabinet Sales of North Florida is your one-stop source of quality cabinets. For a free estimate, call 352-427-2647. That's 352-427-2647. Cabinet Sales of North Florida.
Hi, Danny Warfel here. Get moving with Florida Credit Union's fast and easy loan approval process.
Let Florida Credit Union start up a new car loan for you today. No more waiting, hassles, or stop signs. You can even apply online. With a strong financial team behind you, you can enjoy great rates and fast approvals.
It's all about personalized service and a streamlined process.
Florida Credit Union, connecting your money to your life.
All right, 17 minutes after 11 o'clock. The phone line is open, by the way. If anything that we are talking about has stimulated a question that you want to ask, go ahead and call. The number is 622-9622. Brittney Marthaller is here, and she has invited two guests, Renee Genther and Dr. Kristy Paquette. We're talking about the new survivorship clinic for cancer patients at Ocala Health, and it's the survivors, the people who have cancer, who have beat it, who have defeated it, right?
Survivor.
I did. I had a little thing on my nose. It's gone. I should have come to your classes. I'm a survivor. Yeah.
Do you need to talk about that, Larry?
Can I?
Do you want to share?
Oh, I would love to. Brittney, explain the difference. Before we went on the air earlier, you were talking about there is a difference between what this is and what we've had before.
Well, there has been services for support, and although that's a piece of the survivorship clinic, this is really, Renee is going to be taking these patients on and, like she said, creating a 5-year plan for their medical care so that things don't get missed. They are, so that support goes along with that, but it's not, as if, you have a room where everybody's, an open circle and everyone's sharing.
Right.
So
right.
it's really much deeper and much more important than just support.
And how do you know what extent each person needs? How do you know?
Well, everything we do in oncology is evidence-based, and so as far as a 5-year cancer plan for a patient or a follow-up plan for a patient, a survivorship plan, it's going to be based on their diagnosis. It's going to be based on what stage they were treated at. It's going to be based on what treatments they've received in the past. So their treatment summaries are going to be vital for me so I can develop their plan, because every one of them is going to be a little bit different depending on the patient.
And how often do they go?
To
the clinic?
It could be a one-time visit just to get a survivorship plan in place, and then that way I can distribute it to their oncology team and their primary care provider. And my goal really is to get everybody that takes care of this patient on the same page so that their care is basically, delineated and they understand what to do.
And it's new. How new is it? How long have you been doing it?
Well, I've been doing oncology for 13 years, and I've always followed patients throughout their cancer.
So this, in a way, is something you've been doing, but didn't have a title or something.
Exactly.
Okay.
It's a more formal process.
So you were the perfect person to get it going.
I've been so excited to get this going. It's been something I've been wanting to do in Ocala for a long, long time.
Oh, wow.
So I was surprised because I was not hired at Ocala Health to do a survivorship clinic. But once I started navigating, and when I navigate patients, I also catch patients who I talked about.
So you saw the need. You saw something the rest of us wouldn't have seen.
Well, I think people see it, but there's really not been a way to do a formal process about that. But now that I've seen it, I went back to them and I said, we really, really need this clinic for our community. Can we please do this? And the answer was yes. And I'll be honest, I was surprised. It's not easy to get support.
Was it political? Was there money involved? I mean,
well, there's always money involved.
Somebody had to say yes.
This is a definite need, and you have to understand that when you are able to give patients a survivorship plan and get communication within the providers in the community, it's always a plus. And so there wasn't any resistance at all, to be honest with you.
Is this only for new patients, or maybe somebody was diagnosed with cancer maybe 5 years ago? Can they come in?
They absolutely can. Yes, they can. And I've had a lot of patients, and a lot of my old patients have said to me, can I come to your survivorship clinic? And I've said yes, because...
How old are they?
How old are they?
I'm teasing. Teasing some of your old patients.
You do know we live in Ocala, right?
Well, and I'm excited about this because, I've talked to many women, especially with the breast cancer community, who at the end of their treatment, the doctor says, okay, great, good luck. Mm-hmm. And they still have these deficits, and it's still difficult for them to, put on their bra or brush the back of their hair. And it's frustrating that, they were just released into the world without anyone saying, oh, we can help you with that.
And I can imagine, they get home, they're done with the surgery, and everybody says, okay, let's back to normal. But I can understand that element of this, that it's not
normal anymore. It's a new normal.
Yeah.
It's hard for people to understand that it's okay that it's
We
normal.
have no clue what you women go through, us guys.
Men go through it too, though. I mean, men really do go through it too, because you really don't go back to just that normal life where you were kind of carefree in your mind. You didn't think about cancers for the rest of your life. Every time something happens, you're going to think, was that this, is that? You're going to be wondering, is that cancer coming back? And
men don't walk away unscathed. I mean, how many people who have had prostate surgery and now dealing with incontinence or dealing with, sexual dysfunction? I mean, they walk away with scars too.
It's huge.
And how about the person, the man that was diagnosed with cancer? He's a survivor now, but he now has more of a physical limitation. Maybe he was in construction or some other kind of things, and now he might have to go on a new career. Do you help him in that regard?
What I can do is I can get them into service, because it's like we were talking about before. We want to get them back to their baseline if possible, and most of the time you really can get people back to their baseline. When you can't get them back to the baseline and they're in a job where maybe they can't go back to doing something else, or I have faced a lot of situations where patients really aren't going to be able to work anymore. I work with the case managers, the social workers, and we work to get them onto disability if they need it. We try to find them the resources they need so that they can continue. And then as far as employment after cancer, that's always a hot topic. We could talk about that one all day by itself, actually. There's a lot of information out there people need to be aware is available to let them have those conversations with their employers of, I can't do this anymore, I can't stand on my feet anymore for this many hours a day. What are my alternatives? Some processes that go with that.
And as a physical therapist, how do you work with the patient and the employer so they can come to physical therapy and not lose their job if they have to take time off from work for that?
Right. Well, we have a flexible scheduling. We have clinic hours, so it's later in the afternoon or earlier in the morning, so, people can come around their work schedules and definitely.
Is there a way for you to kind of take us through this, like if we were not to play act, because we'll probably do it poorly, but I mean, does it start out with questions like? And the other part of what I wanted to ask you, somebody listening right now who says, gosh, I wish they had this 7 years ago when I went through this. You said you do take old patients, so they can knock on your door and say, hey, and maybe they go through Brittney or something. How do you get into a program like this?
So what happens is, because I'm a nurse practitioner, and so it would require referral, because I'll be seeing them as an actual medical patient.
Okay.
And what will happen is, by referral, from any one of whether they see a nurse practitioner or a doctor, they can make a referral to me. So it could be their primary care doctor or their oncology facility. When I get that referral in, I will get the clearance to obtain all their records from all of their cancer information.
Okay.
So prior to them ever coming to the clinic, I will have a lot to review. and put together and put into a formal process for them. Then when they come in, I'll be doing a physical exam, talking to them, and determining where they're at now and what their needs are. Do they need nutritional support? Do they need physical therapy support? Do they need mental health help?
Okay, so that's where my little play acting comes in.
Okay.
Because I want to know what they need to know that they don't know right now, the listeners. So I come to you and I say, ever since I had this cancer, it was 5 years ago, I always feel, what's a good word, like run down, like fatigued. Can you help me with that?
Yes.
Or like Dr. Paquette said, you have some scarring tissue. I never knew that you have a program where I can lift my arm again, right? So
Exactly.
that might be something somebody would. I'm trying to push buttons with the listeners, so that somebody says, "Gosh, I didn't know this was available," so that it's more specific.
So when I see a patient, I identify the patient, and I identify, okay, this is an issue for you. Well, let's figure out what it is. When you talk about fatigue and they're really delayed, sometimes they're actually having depression or having some coping problems still.
Oh, wow.
So that can
Okay.
contribute to fatigue. So, I kind of have to figure out what we think is the cause.
Okay.
And then either I can help them then and there. Maybe they won't need anything assistance, or maybe I'll say, you know what? You're still having problems with this. I'm going to get you set up with, a counseling service. Or maybe they have questions about it. They're a little resistant to it. So once a month, we're going to actually have a counseling service forum for them to come meet and ask questions, just in more of an open forum. If I identify someone has neuropathy from their treatments and they're having a hard time with mobility or having scar tissue, they don't have lost range of motion, I can put a referral in for them to go see Strive, to see a physical therapist, to get the physical therapy they need. So I can get them into whatever they need to get back to their baseline again. So get them locked into that care.
All right.
And this is covered by insurance, what
Yes,
you do?
ma'am. Yes, ma'am.
Oh, okay, excellent.
And the sexual thing too?
Well,
Oh, okay. You said some guy. You said the guy goes in there, he gets this.
No, we joke, but it's actually a very it's a very valid point. Sexual dysfunction for both men and women. It's not just because women have body image problems after treatments, because a lot of times they've had their bodies augmented.
Sure.
And the same can be for men, and because a lot of things can happen when you do treatments. They can actually have problems with vasculature, issues afterwards, or they have problems with erectile dysfunction. So yes,
You said that so fast, right?
Erectile dysfunction.
I know.
So
I do the same thing. When it's a word I don't want to say, I say it, penis. I just say it really fast.
So when they have ED, we can actually look to say, okay, maybe you need to see a urologist. Maybe you need. So we can look at resources for them. Absolutely.
And I'm really trying to be serious, although just like saying things fast, I'm uncomfortable. But at the same time, somebody listening might say, you know what, I really wish somebody would talk to me about this.
Right. Exactly.
Right.
So good for you. Good for you for making this clinic.
Yeah, exactly.
Or lymphedema. I mean, going back to the breast cancer scenario.
What is that? What is that?
Anytime you have lymph nodes removed, you're at greater increase of swelling. Your body just doesn't flush that fluid back out.
Brittney, did you know my mom at all? Her arm got so huge and it was so painful.
Yeah.
Yes, it's miserable.
And they didn't know, the doctors they couldn't do anything. They didn't know what to do.
Oh, we have lots of resources for that now.
Absolutely.
Tons, yeah.
Yeah,
good.
there are certified lymphedema specialists who can do some, circulation massage, and then there's special
Gosh, it was
garments
Yeah,
to
they're
help
joke stocking.
reduce.
so painful for her.
Yeah.
Like, she had some kind of almost like like a support sock,
Yeah,
but it was
there's a
on her
joke
arm.
stocking, yeah.
Right.
And I think that did help, but then it hurt, and it was
There's
back
lots
and
And
of
once you take it
resources.
off, it comes back right away
Yeah.
again if it's not getting treated properly. So.
But anyone who's had lymph nodes removed is at risk.
We are almost out of time, so we need phone numbers. And Brittney, do you want to do all that?
Yeah, if you'd like to get in touch with the survivorship clinic, and over at Renee is 352-401-1534. If you'd like just more information about Ocala Health, or to get involved with or get connected to a primary care provider or any specialists in our area, the number is 800-530-1188, and that is a free service provided by Ocala Health.
All right, excellent. And Kristy, your mom is waving. You want to wave?
Hi, Mom.
I see her waving right now. Just gonna say, did he really see me?
She will. She's, I'm sorry to say, a little computer illiterate.
She didn't hear that. It's okay.
Well, Renee, congratulations. I think it's awesome that somebody saw a need, did something about it, and then you were able to convince people to hear what you have to say and make it a reality. So good for you.
Thank you very much.
Good for all of you.
I'm very excited for
Really a
WOCA.
wonderful, wonderful resource.
Thank you for what you all are doing. You make the world better. You make my half hour better every time you come in here. So
Thank you.
we need to take a
Thank
break.
you for having us.
Thank you. If you missed this, or if you want to share this with somebody, I should say this will be up as a video by 2 o'clock this afternoon, I hope. But if not, then by tomorrow morning. Thank you, everybody. We'll be right back. Something about it, and then you were able to convince
Radio. I'm Lillian Wu. Republicans are warning the president not to act alone on immigration reform, the focus of his announcement tonight. House Minority Leader Nancy Pelosi insisting
the law is clearly with the president.
Republicans are weighing legal